Your joints ache more frequently now, sending you reaching for that familiar orange bottle of ibuprofen multiple times each week. Therefore, your morning stiffness drives you to pop another pain pill before starting your day, creating a regular medication routine. But this persistent back pain has you taking these anti-inflammatory pills 3 or 4 times weekly without considering the consequences. Therefore, your trusted painkiller is quietly sabotaging your cardiovascular health after age 60 in ways you never suspected were possible. Your regular ibuprofen use is silently raising your blood pressure right now, creating cardiovascular risk you cannot feel or detect. Therefore, your stroke risk increases measurably from this hidden cardiovascular effect that occurs within just 2 weeks of consistent use. But this regular ibuprofen raises systolic pressure by 5 millimeters of mercury, which is enough to require complete medication changes.
This video is for educational purposes only and does not replace professional medical advice from your doctor. Ibuprofen belongs to the NSAID class, non-steroidal anti-inflammatory drugs that block COX enzymes throughout the body. These enzymes produce prostaglandins molecules that regulate blood vessel tone and kidney sodium handling. When COX enzymes are blocked, the kidneys retain more sodium and water, increasing blood volume and raising blood pressure. This effect is modest in young, healthy adults, but becomes clinically significant in people over 60 with existing conditions.
Let us examine number 2, which is the clear cardiovascular evidence against regular NSAID use after age 60. Therefore, the data here is consistent across multiple large studies, and every major cardiology guideline has formally responded to it.
A 2017 meta-analysis in the British Medical Journal analyzed data from more than 446,000 patients across 61 studies. Regular NSAID use raised hospitalization risk for heart failure by 20 to 50% within the first month of use. In hypertensive patients, NSAIDs directly antagonize the effect of ACE inhibitors, ARBs, and diuretics, reducing their efficacy. This means ibuprofen can effectively undo the cardiovascular protection your blood pressure medication is designed to provide. The risk is dose-dependent. Higher doses and longer use produce progressively larger elevations in blood pressure. Even low-dose ibuprofen taken for 2 weeks produces measurable blood pressure increases in people over 60. NSAIDs further reduce kidney blood flow, which can precipitate acute kidney injury in older adults with naturally declining kidney function. The combination of NSAIDs with diuretics and ACE inhibitors, very common in older adults, dramatically amplifies kidney risk.
Let us discover number 1, which covers safer and more effective alternatives for pain management after age 60. Therefore, effective pain management does not require accepting cardiovascular risk, as well-evidenced alternatives exist for most common conditions.
Acetaminophen, the over-the-counter OTC pain reliever known as Tylenol, is the first-line recommendation for osteoarthritis pain in all major rheumatology guidelines. It does not raise blood pressure, does not affect kidney blood flow, and does not interact with antihypertensive medications. The correct dose is no more than 4 grams per day, with normal liver function never exceed this. Topical NSAIDs like diclofenac or ibuprofen gels deliver anti-inflammatory effect. These over-the-counter formulations are available at most pharmacies. Evidence from randomized trials shows topical diclofenac provides equivalent pain relief to oral NSAIDs for knee and hand osteoarthritis. This is a genuinely underused option. Ask your pharmacist about topical formulations at your very next visit. If you take ibuprofen more than 3 days per week, discuss this at your very next doctor appointment. Effective pain control and cardiovascular protection are not mutually exclusive. You just need to choose the right tool.
By the way, I covered other crucial details on this topic in my full video. The link is on the channel. Therefore, if this video helped you today, please subscribe to the channel, leave a like, and drop your comments.